The coronavirus disease 19, also known as COVID-19, affects hundreds of thousands of people around the world. This virus first began spreading in China and was related to a pneumonia outbreak. Coronaviruses are a large group of viruses that until now have mostly been found amongst animals. The current COVID-19 cannot be passed from animals to humans. With so many people being affected by this virus, knowing its symptoms is a great starting point to help you assess your current situation. The symptoms of COVID-19 can show up 2 to 14 days after you have been infected. These symptoms include fever, cough, shortness of breath, a sore throat. Whether you have these symptoms or not, you must act safely. To do that, let us understand how you can catch this virus. If an infected person coughs or sneezes near you, the saliva droplets can land in your mouth or nose or can be inhaled into your lungs. If you touch or shake hands with an infected person, and if you touch an infected surface or object and then touch your eyes, nose or mouth before washing your hands. Without proper testing, it is almost impossible to know for sure if someone is infected. It is true that people who have traveled to or from infected areas recently are at great risk of having contracted the virus. It is also true that the elderly and those with underlying illnesses are at risk of falling gravely ill as their immune system is already compromised. Despite all of this information, the best you can do is to avoid human contact as much as possible. Whether avoiding human contact is possible or not, given your circumstances, here are a few prevention steps to remember. Wash your hands with soap and water often. Do not touch your eyes with unwashed hands. Stay away from those who have the virus. When you sneeze or cough, cover your mouth with a tissue and then throw it away before washing your hands. Lastly, if you are feeling any of the symptoms we have mentioned, please stay at home and contact your doctor by phone as soon as possible. Currently, there is no vaccine or antiviral treatment for COVID-19. Even antibiotics will not be able to treat this virus. However, your doctor may decide they can help in case there is a secondary bacterial infection. Our government is monitoring the evolution of this virus in our country and has put measures in place to ensure your safety and the safety of those around you. Some of these measures include 1. Fever screenings at international airports. 2. Procedures for case detection, isolation and management if a quick diagnosis needs to be made. 3. Also, all health facilities will be able to manage suspected or confirmed cases and direct them to quarantine. 4. To avoid the virus from spreading further, protocols are in place to follow up on recently confirmed cases. 5. Nationwide lockdown, where people may only leave their homes for justified reasons like buying food or going to the doctor. If you are feeling slightly sick, please stay at home, hydrate and rest. For more information, visit www.who.int/coronavirus or contact the 24-hour public hotline at 0800 02 9999. Stopping this virus from spreading is in your hands, so please wash them often with soap and water and be safe at all times.